We are in the behavioral health. This is a treatment facility, but we are truly in the miracle business. We're in the business of miracles here. When you can have a shift in perception and live a whole new way in this world, that's a miracle. And this is what we do here at Fora Health. We help people see life different. We help people build the skills and tools needed to be successful, needed to find their way. And this is such a pleasure, such a blessing to be part of that.
Fora Health's new mission is to provide treatment, care, and recovery for all those who struggle with addiction. First of all, our new building is a really beautiful space. We felt it was really important to offer an appropriate space for healing. And at the same time, we also are focused on providing whole person care. So we have a fitness center, for example, or therapy gardens with over an acre of programmed green space. We also have an art studio and offer art therapy. So our focus and our goal at this new facility is really about how we can come to the whole person and help them create the change in their life they're seeking.
This new building has been transformative for medical for several reasons. First, we have our medically managed residential program, which is a program that takes individuals with substance use disorders and either complicated psychiatric or medical conditions into residential care. We did that at our old building, but at our old building, as many people know, we didn't have an elevator and we had multiple stairs. And so to be able to say to those people now, come on in and we'll take care of you, despite your wound, despite the wheelchair, despite the walker, we've got you, feels incredible. We've also expanded our withdrawal management, also known as detox. Withdrawal management is not one big dorm. Men and women are separate, which is huge for people to feel safe, and it's just so much more trauma-informed and loving. So all of those structural changes mean that we can provide so much better medical care to so many more people. It feels wonderful.
So we've been really resilient with all the challenges of the pandemic, and we've been able to really support people, which is really fulfilling, as getting people that are isolated their food boxes and just supplies that they need if they can't get out of their home.
We've had several COVID outbreaks, and we're a residential program, and many of our patients don't have housing. So to manage a COVID outbreak, trying to protect those who don't have COVID, but also protect those who do, who are struggling with substance use but don't have a place to isolate, it is one of the hardest challenges we've faced. Heartbreaking. And we did a great job. You know, people stayed overnight getting patients to hotels and then bringing them care packages and checking in daily. It's amazing. Both staff and patients, it's amazing.
One of the ways we're providing leadership in addiction is we have staff leadership who are absolutely focused on the latest evidence-based practices and bringing them to the patients in our organization, in our facility. Another is that we have doctors who have been recognized in the community for their leadership on developing buprenorphine withdrawal management protocols. And we now have a doctor who submitted and was accepted to a national presentation at the Society of Addiction Medicine on withdrawal management and essentially moving people off of fentanyl and into a buprenorphine medication-assisted treatment.
I think what sets Fora apart from other organizations is the dual emphasis on behavioral health and medical care. As a specialist in addiction medicine who is also a physician, I of course have a strong reliance and belief in medication, and I know that those medications save lives, period. And then what the rest of our organization does is connect and build relationships and build skills that make those lives then worth living. And so I think it's an amazing partnership. It says that medication is important, and it acknowledges that medication is not enough. And when we can bring those two skill sets together, people's lives can be amazing. And that's what sets us apart. And we're doing it for people on Medicaid and who don't have housing and who would never have access to these kind of services otherwise.
One of the ways we are leading in the community is we are opening a patient resource center, and we will be providing wraparound services so patients can connect into the community and their family members can find resources. And that can be services such as employment services or housing services, resume writing services, you name it. Our goal is to be a wealth of information for people who want to restart in lots of ways and connect in the community and live a life that they really are choosing for themselves to be different.
I feel Fora Health is a standalone organization due to our full continuum of care. We have from our withdrawal management, our detox, all the way to inpatient. We have our mental health, we have family therapy, we have peer services, and then once you graduate this, we have outpatient. And the whole totality of this recovery is what's really needed to address these problems.
Within the first 30 days, I knew that this was the right place for me. The counselors, absolutely remarkable. They're so knowledgeable, but also so real. They never talked down to us, never made us feel like we were less than. And I think because I'd always imagined alcoholism just itself as being a shameful thing, and then being taught that it's actually a disease of the brain. And learning that and understanding that I had the ability to change. And I've learned how to think before I act, how to breathe before I speak, utilizing all of this knowledge that they imparted on us through all of the classes and that we were going to take into the real world later.
One of the things I'm most grateful for is that we survived the pandemic, and we have kept people employed. We've not had to cut our services drastically, and overall, we're still here and we're going strong, and we're going to do even more exciting things for the next 40 years.
Fora Health means to me a whole new life, a whole new possibility to live my dreams. And because I would never have had that chance without them.
I'm so blessed to be part of an agency that is part of the healing of the world, that does take care and pride in how we operate and interact with our patients. This is truly a place of hope.